Social Media and Healthcare, presented by Ashley Fuller. Purpose. This presentation provides guidance for embracing social media in the healthcare setting. So why even consider social media? Considering how regulated the healthcare industry is, organizations and providers have generally been reluctant to use social media. The important thing to mention here is healthcare organizations must go where their customers are. And where are those customers? They are online, specifically on social media platforms. Understanding this, many organizations have begun to join social media and are even including it in their strategic goals. Some interesting statistics here. As of January 2015, over 2 billion people are using social media. In the United States, 8 of 10 internet users search for health information online, and 74% of these people use social media for this purpose. In one study, 57% of consumers said that a hospital's social media presence would strongly influence their choice regarding where to go for services. Again, healthcare providers have got to be flexible in their communication methods in response to the changing needs of consumers and society. As we understand, the needs of society and consumers is certainly changing. Consumers are now turning to the online platform for medical advice. With social media groups already established, members develop a trust with one another and rely on each other for guidance when selecting a hospital or a primary care provider. Any healthcare facility or provider that is not visible on social media is not being seen by these consumers and certainly is not creating a large impact for exposure. The previous methods of using postal mail to mail flyers, brochures about newly offered services or wellness events is quickly fading into a thing of the past. Consumers want instant and current access to health events, education, services, and self-help forums. Sure, while embracing social media seems rather risky, the alternative may be even riskier. Again, we must go where our customers are, and that is on social media. Additional advantages to consider for using social media in the healthcare setting. First, it is an inexpensive and efficient platform for communicating with consumers about numerous types of information. For example, the services that you provide, new achievements or awards for the organization, for physicians or other employees, communicate upcoming wellness programs or community outreach programs. This is a great opportunity for recruitment. It is also an effective method for communicating your mission and vision statement. Engaging consumers is also easily achieved through social media. It provides a venue for patients to share their positive experiences and their personal stories. Support forums are also helpful for patients or their family members who are suffering from chronic or devastating health conditions. Engaging customers through educational sources you provide on social media is also effective. You can do this for disease-specific treatment plans, etc. Promoting healthy lifestyles, such as dietary recommendations, healthy eating choices, exercise recommendations. Also, reaching patients in isolated and rural locations is especially important and can easily be achieved through social media. Let's also remember branding. The more the organization's logo and name is visible and seen and in the spotlight, this is what makes the impact. Also, with engaging consumers, we cannot we must remember that this is a core element of meaningful use. And with this increasing push to engage our patients, it is very reasonable to consider that social media channels could potentially provide information about patients that can assist in enhancing their care. After all, we all know individuals freely and frequently post health-related information about their visits to the doctor, the emergency room, on social media. Moving forward, it's very likely to consider that the health information they're posting could be used to modify future patient engagement methods. So, the data posted on social media, of course, this is representing the intersection of health informatics and social media. As informatics specialists can utilize the data posted by consumers about their healthcare needs, education, their complaints, their concern, to cater future patient engagement methods. Disadvantages and risks. At the top of the list is always legal issues, which falls into the HIPAA rules, privacy concerns, licensing issues. In the next slide, I will actually go into a little more detail for the HIPAA rules that apply here. Additional disadvantages and concerns is the inability to control the conversation. This is a common concern in the healthcare industry, that patients, visitors, their family members are going to complain about their service, about the organization, about employees or their physician that they're mad at, and it's going to be a very negative commentary. Yes, this is going to occur, but learning to highlight the positives and manage the negatives is imperative for any organization embarking on social media. Simply ignoring the negative conversations and not participating in them does not make them go away. It is best to respond with some type of positives. Also, using social media in healthcare opens the organization for public criticism. Again, customers are already talking about companies online. By joining them, companies can actually help direct the conversation. HIPAA rules. HIPAA was passed by Congress in 1996. Since 1996, HIPAA has been modified to address modern technology, the internet, electronic systems, email, etc. HIPAA has many rules. The two that we're going to focus on here in regard to social media are the privacy rule and the security rule. The privacy rule protects patients' identifiable health information. Protects an individual's right to control the use of his or her information. The security rule was specifically designed to protect electronic information. Some ethical considerations. A common concern is that online friendships can alter patient-physician relationships. And this is true, as patients may find physicians online and send them a friend request. Communications can turn from just simple conversation into more like of a health advice consultation question. So these are true, legit considerations that must be addressed by the organization's social media policy and through education of the physicians and other employees. Each party's privacy may be compromised due to absence of adequate and conservative privacy settings or by their inappropriate use. The privacy settings, of course, rely on the social media platform. For example, Facebook has their own privacy settings, Twitter has their own, and these settings are, of course, ever-changing, so they may not be exactly adequate. unauthorized photo, video upload of patients' body parts or procedures. This must have a handwritten, informed consent from the patient. This is a legit concern in healthcare, uploading videos to social media through Vine, Snapchat, where people think they're going to actually be deleted in 10 or 15 seconds. The concern here, these images can be downloaded and forwarded along by others. Again, taking video and photography using personal devices or facility-owned devices on the premises of an organization has got to be addressed in the organization's social media policy. Another concern is that medical students are not ready. There are current conflicting issues between academic freedom and freedom of speech, which gives rise to complex ethical dilemmas. A survey of 130 U.S. medical schools in 2009 actually revealed that 60% of the respondents reporting incidents of students posting unprofessional online content, including violations of patient confidentiality. So, many healthcare organizations do have students. Again, this would have to be addressed in the social media policy for the organizations, and the students would have to be educated during the orientation process. With all the ethical consideration, it falls back to professional codes of conduct, and healthcare professionals are obligated to adhere to their profession's standards of ethical and professional conduct in all interactions, including those that occur on social media. So it is common when preparing to embark on a new mission, such as implementing social media, to see what other organizations are doing. And research shows, despite legitimate concerns regarding social media and healthcare, 70% of U.S. healthcare organizations use social media, with Facebook, Twitter, and YouTube being the most popular. So, getting started. Where to start with a plan to implement social media? And here, there is no need to reinvent the wheel. Gain knowledge from healthcare organizations with established social media sites, and there are many out there to gain valuable information from. A great source is, of course, the Mayo Clinic. And in 2010, the Mayo Clinic actually paved the way for others by developing their social media health network. And the Mayo Clinic is considered the gold standard for the use of social media by healthcare organizations. By visiting the Mayo Clinic social media site, users can view online webinars, learning modules, policy guidance, and other resources specific to the development of social media. Additionally, utilize local resources, such as partner companies that have active social media, or other healthcare organizations or providers that are in the local area that have implemented social media. Use them as a guide. Always important is doing your homework. Perform research. There is a vast amount of research on healthcare and social media, and this is a great starting point. Starting a social media project. This, of course, begins with development of a social media team. You must define goals and objectives that align with the organization's mission and vision statement. Some interesting references here. A well-executed social media presence requires a defined audience and a clear purpose. The team should include multidisciplinary representation to include public relations, legal, administration, IT, marketing, clinical, and community. So, a very well-rounded social media team to ensure adequate representation of the organization. Step 2 is the development of a social media policy, and this is not always easy. There are plenty of social media policy templates and examples available on the internet. Some of them are very stringent, while others are very lax. So it will be up to the social media team to determine what type of policy to implement. And in another slide, I will provide some guidelines for a social media policy. Step 3, educating the employees and associates. Certainly, with any effort of a large-scale project such as social media, educating the employees is important. They have got to understand the terms of the social media policy so that they are also in compliance. And with the education of employees and associates, it is important to not only exclude the policy to employees, because often you have vendors, volunteers, students, other associates of that nature within the hospital or healthcare organization who also need to comply with the social media policy. Step 4, start small. There are many avenues of social media. It may be best to choose one, such as as an organization, we shall start with Facebook, and after that is up and running and working well, maybe later implement additional social media outlets. But starting small, getting a good foundation is the best plan for success. After implementing a social media policy, educating your employees, and embracing social media online with an organization site, it is important to monitor the activity of that site. You must monitor all posts and activity that occur within the organization's owned social media platforms. Requirements of a social media policy. Now, there are also many examples of this, but this provides some basic guidelines. First, define acceptable use. Employees must understand what is acceptable and what is not within the terms of the policy. Ban, limit, or monitor employee access to the internet and or social media sites. This can easily be accomplished through your IT department. They can apply settings through group policy or other means that limit access to social media on the organization-owned devices. However, employee-owned devices is not so easily accomplished. Again, this has to be specified in the policy. If employees are only permitted to use social media during break times, the policy must state so. Define employees' responsibilities when witnessing inappropriate use of social media. Again, your employees, they must understand the process for reporting inappropriate use of social media. And this is most concerning in the healthcare setting, where videos and images can easily be captured on personal devices. And when patients are included accidentally or not in the images, the HIPAA rules apply. The policy should certainly define disciplinary actions for the inappropriate use of social media. The policy should designate who can access social media on the organization's premises and for what purpose, specifically the social media team. Those employees designated to monitor and edit the social media site would have the permission to access social media during on-clock time. Inclusion of the HIPAA rules is absolutely essential in your social media policy. Including a "views are my own and do not represent the views of my employer" disclaimer is a common requirement for social media policies. This ensures that employees are not speaking on behalf of the organization. Also, you must revise or expand any current policies regarding patient consent. For a social media tip sheet, as you implement a social media policy, it is important to educate those who apply to the policy. This is an example of a social media tip sheet. It highlights the policy terms and provides a very easy guide for the safe usage of social media. It is important that all applicable parties are able to understand the policy terms. And in a healthcare setting, you have varying levels of education. So a tip sheet such as this with basic verbiage that everyone can understand is well suited. For additional resources for social media policy, there are numerous. Here are a few from the CDC, HIMSS, the Cleveland Clinic, Sutter Health, Ohio State Medical University, and Vanderbilt University Medical Center, and this represents a large variety of social media policies. So, for an example of social media as it's used in healthcare, the Henry Ford Health System engages patients using numerous social media platforms. They use Facebook, daily, Twitter, a wellness blog, YouTube videos, and numerous other social media forms. Henry Ford Healthcare System actually broke news in 2009 when they provided Twitter feeds during a surgical operation. As physicians performed an extensive surgery to remove a cancerous tumor, I believe it was from a liver, the surgeons and surgical tech team updated followers and other interested individuals. Some were medical students and other physicians. They kept them updated of the progress of the surgery through tweets on Twitter. And this certainly was a groundbreaking news event in the healthcare setting. And since then, the same healthcare center has tweeted other surgical procedures. The point here is that this Henry Ford Healthcare System social media platform is comprehensive, is heavily used, active, the consumers enjoy it. At being able to access all these resources from multiple personal devices anywhere, it is providing the instant access to healthcare information that consumers are looking for. So, future directions with social media. Future directions involve using data gathered from social media. In 2010, the first study using social media to predict future events occurred. 2 men published a paper about predicting the popularity of newly released movies. Unlike previous studies, this study relied only on social media posts, and it was specifically tweets on Twitter. Using the tweets on Twitter, they made their movie predictions, which proved to be true and beat former movie prediction models. So, these two fellows actually proved the utility of 140 character sentiments. Although this is a movie-related post, quote, the overall message is to focus on the predictive methods used here. They're using data posted on social media to predict movies, just the same as data on social media can be used to predict future healthcare needs or events. So, future directions with social media and healthcare specifically. Harnessing the power of the data. Data, data, data. As more users create data, this means more opportunities for businesses to extract the data regarding their customers. In other words, take all this data and turn it into information. And here the healthcare industry can certainly benefit by predicting disease outbreaks based on content that is posted by individuals actually on the ground. The opportunities here are endless. For example, at a more local level, healthcare organizations can utilize data from local communities to determine community needs for maybe disease-specific education or other wellness activities. Certainly, the opportunities here are pretty phenomenal. And in closing, social media has become an undeniable force, and its rapid, informal communication style represents both possibility and liability for healthcare organizations. Good policies and training help organizations pursue the benefits and mitigate risks. Again, consumers rely on internet sources and social media for health information and in making their healthcare decisions. It is important to understand this because healthcare definitely is a competitive market. It is imperative that organizations stay current, that they understand consumer needs, and that they meet those needs.